Welcome to the Docs Who Lift podcast, where we distill and simplify the complexities of a healthy lifestyle, exercise, medicine, and weight loss. We're excited to bring you a podcast that's a prescription for clinical practice, scientific recommendations, and just real life. This is the Docs Who Lift podcast.
Hey, and welcome back to the Docs Who Lift podcast. I'm your host, Dr. Spencer Nadolsky, co-host Dr. Carl Nadolsky Jr. We're going to go over some hot topics for the week. The Olympics are going on as we speak, so there's some interesting, controversial stuff going on there, along with some non-Olympic related things with GLP-1s, including...
No, I can't even believe it.
Yeah, including some top-line results for my favorite drug, tirzepatide, showing some improvement in heart failure with preserved ejection fraction. We've talked about this actually a few times with semaglutide specifically. And again, these are top-line results. We do not have the full study, but I thought we would just take a little mention of it. And along with some interesting results looking at liraglutide, which is the trade name for Victoza for diabetes, type 2 diabetes, and Saxenda for obesity, showing some potential protection and improvement in Alzheimer's disease, which is a hot topic as of late. And regarding the Olympic stuff, there's some controversial things going on. There's a rugby player that kind of shot back at someone on their social media looking at the BMI. We'll talk about that. And then the boxing that everybody's talking about, the boxing thing. So we'll just talk about it. So a few little things about it. We don't have all the data, and there's some speculation, but we thought we'd just give a brief little bit about that. So what do you want to start with?
Let's start with the liraglutide, just because this is kind of we don't have a ton of information on this, and a lot more future research has to be done. But certainly, there's been a lot of interest with these GLP-1 receptor agonists, because obviously they improve weight, improve diabetes, reduce risk of heart disease. We're going to talk about the heart failure deal. All these cardiometabolic factors play some sort of role in the development of Alzheimer's. So they're studying these because of some animal data, I think, that showed some promise. And so now they're studying this in humans. So this was a phase 2B. They called it the ELAD clinical trial. Adults with early stage Alzheimer's disease. And essentially they were randomized to liraglutide at the diabetes dose, 1.8 milligrams daily versus placebo. And the bottom line, and this was presented at just the other day, like last week.
So it's not published.
No, this is not published. This is just presented at the Alzheimer's Association International Conference of 2024. And it was, small study, only 200 patients. Randomly to the liraglutide or placebo over 1 year. They did brain MRI at baseline and at 12 months, along with neuropsychometric evaluation and a PET scan, interestingly enough. Now, the primary endpoint, which is what studies are, statistically designed to look at, they were looking at changes in the cerebral glucose metabolic rate in the cortical regions of the brain. The hippocampus, medial temporal lobe, posterior cingulate was not met. So they were looking at very specific things, assuming that these would be associated with
so the primary
Alzheimer's.
Outcome was not.
So just to be clear, and we'll, when it's published, we'll have to take a look at it.
Then we don't know what the...
Right. But they had a bunch of other secondary endpoints that they were looking at, and these are what our friends would call hypothesis generating and can lead us to do more research. So essentially, they experienced a significant slowing of cognitive decline compared with placebo, and that was actually statistically significant. And it was a composite score of 18 different tests of memory, comprehension, language, and spatial orientation. So I think that's interesting. And it wasn't necessarily powered to assess the cognitive changes, but overall an 18% slower decline in cognitive function over the 12 months compared to placebo.
Well,
so
then,
I think that's interesting.
And then the other thing is that there's less volume loss.
Yeah. So 50% less volume loss in several areas of the brain involved in memory, language, and decision-making, including the frontal, temporal, parietal, and total gray matter. And that was measured in MRI. What I think they don't really know, and maybe we need to get neurology on board to talk about this once they're published, because what they say is they don't really know if that means anything. It's just all kind of associated. And, a lot of future research is going to be done here. So large phase 3 trials need to be done and are underway. And in fact, there is a phase 3 trial looking at the weekly semaglutide Ozempic Wegovy molecule.
I think if there's any chance in hell, liraglutide's all right.
It was one of the OGs.
The semaglutide, if there's an effect, semaglutide or tirzepatide. And so I think the bottom line here is, it's preliminary. We can't really say much, but if you have type 2 diabetes and obesity and potentially a higher risk of Alzheimer's disease, I think it's reasonable to look at this medicine simply to take care of your other risk factors. So,
and in hopes, and it would be nice to know if this would help benefit. Now, there are some really interesting, true neurological studies and results recently with new medications for Alzheimer's disease, well beyond our level of expertise.
We'll have to get a neurologist
so we could get someone on to talk about that stuff.
Yeah, kind of interesting. So there's all GLP-1 receptors all over the body that we talk about it all the time, having effects that go beyond just a glycemic and weight benefit. So it'd be really interesting to see that, because a lot of people are, they want to live longer, but then you don't want to live longer and get Alzheimer's disease and have cognitive issues.
It's a big deal, unfortunately, for a lot of people.
All right, so the next big thing was tirzepatide, Eli Lilly. Again, we don't make money from Eli Lilly, not yet. And they just came out with their top line results. They made a big press release. Also, just a note, the top exec CEO from Eli Lilly claims that within days that the shortages are going to be over. That's what he says.
They're also sponsoring some of the Olympics, and I saw Simone Biles and her mom on a commercial for Mounjaro.
neither of whom take Mounjaro. So I don't know.
Her mom doesn't even take Mounjaro?
No, I don't think that was part of the issue.
Oh, whatever.
They don't need to promote. They don't need to promote these.
Yeah, I really wish we didn't spend millions and billions of dollars on direct consumer marketing. Oh well, but I'm glad Simone Biles is getting paid, because she
needs to get some.
That's awesome.
She needs to get some money. But whether
talk about the GOAT, my good lord,
the shortages though, I'll believe it when I see it. Now the other thing is that these companies, manufacturers, are the ones who submit the data that FDA gets. So it's like, there are no more shortages, even if there are. It's coming from big pharma. So I don't know. I'll believe it when I see it. But I will say, anecdotally, other doctors are saying they're maybe going to get some samples here soon. That's always a good sign. And anecdotally, I'm reading, my patients, and also on Reddit, I lurk on there, and people are saying, I'm getting all the doses, except there are 2 doses that are limited availability. They're the higher doses, I believe. So anyway, we'll see what it says. But anyway, let's get into what is this? The SUMMIT trial.
Yeah, the SUMMIT trial for tirzepatide in people with obesity and heart failure with preserved ejection fraction. Now, I guess I'm going to refer people back to our
2 of them. We've done
a couple podcasts on that. We talked about the actually published results for semaglutide in these patients, both with type 2 diabetes and obesity without type 2 diabetes, but with heart failure, preserved ejection fraction, which is, it's a very debilitating dysfunction of the heart for people who are struggling with obesity. And it's a vicious cycle. You feel miserable. There's a high risk of death, the high risk of hospitalizations, and you can't exercise, so you can't get healthier. It's just a bad, vicious cycle.
Terrible. So, it's a very terrible, and we don't have any cures or anything for it at this moment, but we have
now
drugs
starting
that
to
are
see some
improving it. And just
a
reminder that this type of heart failure, you have a big, stiff kind of heart, thicker heart, and it's hard to get blood actually into the heart. So for this one, it's kind of similar improvements based off of just glancing at it. There was more weight loss in this one.
Well, so, which makes sense, of course, because tirzepatide, Zepbound, Mounjaro does have more weight loss. So in this randomized controlled trial, it was a 52-week trial. Bottom line for the weight was almost 16% weight reduction compared to a little over 2% for the placebo that's getting just diet and exercise advice. And so that's, a very significant weight reduction for these types of people.
And that's only 52 weeks. Remember, the usual SURMOUNT trials were 72 weeks. So there's 20 weeks fewer So they might have tracked on to go get the usual 20 or so percent that they get from this over 72
Yeah.
weeks. But
beyond that, they were looking at, so in this case, their primary endpoints, were a reduction in the risk of heart failure outcomes assessed as a composite, meaning all these things, endpoint, and improvements in heart failure symptoms, physical limitations, measured by the Kansas City Cardiomyopathy Questionnaire clinical summary score compared with placebo. We talked about what that was before, but I'm always more impressed by these 6-minute walk tests. I think these results are pretty remarkable, in my opinion, that we can talk about. But so the bottom line with this is that people are losing weight and feeling a lot better, with the results showing in that composite heart failure outcomes. So that means heart failure, urgent visit or hospitalization, or they had to intensify their diuretic medicine, the medicines that make people urinate out their water, or cardiovascular death. They had a 38% reduction compared to the placebo.
yeah, again, I don't know if it seems similar to the one with semaglutide, but I know that semaglutide one did the Kansas City cardiomyopathy outcomes.
Yeah, similar stuff.
Questionnaire.
But even more important to me, I feel like they do these composite outcomes and stuff, and that so there's certainly a benefit from clinical outcomes, but they feel better. They had dramatically improved heart failure symptoms and improved, or reduced physical limitations, but much better, physical function.
Yeah, this is what most of the patients say. Again, inflammation in their knees, inflammation in their joints and everything like that. So all of a sudden they feel better, they're able to do more. And so with heart failure, preserved ejection fraction, we want them to still live a healthy lifestyle. This medicine allows them to improve their healthy lifestyle. So,
and they're able to walk a lot farther, in that 6-minute walk test. And we'll get more details on that when it's actually published instead of just presented. But think about it. If you can feel better, walk more, lose more weight, get healthier, make your cardiometabolic complications get better, then do more exercise, more cardiac rehab, improve your heart function. I mean, get that vicious cycle going in the right direction. That's amazing.
Yeah, these aren't just a Band-Aid for whatever. Yeah. They actually help facilitate a more helpful,
treating the root issue, really
healthful lifestyle. So all the haters, I don't know. It doesn't matter. These drugs work so well that eventually everybody's going to be. I think everybody's going to be taking some of these things at some point.
Boy, if we get enough and they're, and they're cheap and whatnot, and we prove that, the safer they are long term, more and more people will be on. For now, they really should be reserved for those with the most severity of disease, to be honest, because we get the most bang for the buck, et cetera. But that's a debate for another day, too.
The trial that I'm really looking forward to with tirzepatide is this MMO trial where they're going to look. It's kind of similar to the SELECT trial, but it's a little bit different. But looking at cardiovascular disease, I think we're going to see similar outcomes that we saw.
We certainly expect so. And in all the big phase 3 trials, there's a significant trend towards that, but those are not powered or designed to look at actual cardiovascular events. But I think we all expect it.
Yeah.
And it should be pretty awesome.
All right. So tirzepatide still, works in those with heart failure and preserved ejection fraction. We don't know the details other than these top line results, but something to look forward to. All right. Let's talk about the rugby player who I don't want to say got attacked, but just, someone making an offer.
Because haters online, they're being assholes. The people sitting on the couch commenting on the best athletes in the whole world.
Yeah, I know. That's always like, they should have done this. They're commenting on Simone Biles back 4 years ago because she had the twisties and they didn't understand all these different things. Yeah. Anyway.
And they attack the mental health stuff. Like, oh my God, while they're sitting on the couch.
Yeah. So someone said this. This is
by the way, the female rugby team, they got like the first rugby medal for the United States in like 100 years.
Yeah, that's pretty cool.
Right? I mean, that's amazing. That's really cool.
So this I don't know how to say it.
Her last name is Maher, right? Maher.
Maher? Like Bill Maher?
Bill Maher?
I don't know.
Maher? Not sure. Sorry.
She has.
But you're awesome.
yeah. She's a very strong, fit rugby player on the women's team, and someone made a comment about you look like you have a BMI of over 30 or something like that. And she actually
She went on TikTok.
She replied via TikTok and was like, well, actually it's 29.3 to be exact, is what she said, which actually, she is very fit, like lean. If you go to her TikTok, I mean, she's got pictures in her bikini and working out and things like that. She's pretty jacked.
She is muscular.
Apparently
she's 5'10", 200 pounds maybe.
Somewhere around there. That's what she said. I don't know. It's hard to tell based on pictures, but she definitely does not have a lot of adiposity based on just visually. But she goes in to talk about how the BMI isn't as good of a marker in those who are athletes. And we've had a whole podcast on BMI. We just want to make sure that BMI does work for the general population on a population level. On an individual level, it should be used just simply as a screener. I have a BMI of similar. It's something like 28 or something like that. I used to have a BMI of 30 when I was a heavyweight. I was also force feeding pizza. I was eating whole pizzas.
And you may have had abdominal obesity.
No, I didn't. I had a 30, probably 38 waist.
Okay.
But my neck I definitely had sleep apnea.
Yeah, you did.
I'm fairly certain. But the point we are just making is that, like, hey, and most people aren't going to have in a doctor's office an Olympian walking in. I don't think I've ever had an Olympian.
I always use the example of a 22-year-old college or professional linebacker.
Linebacker is pretty good.
Someone with a BMI of 30, big muscles, very healthy, no abdominal adiposity, and the BMI might screen them to say, oh, hey, look at this. They might have obesity, but doctors need to be doing personal examinations to confirm if that BMI should be classified as it's representing excess adiposity. So, I've helped write some guidelines in 2016. We wrote ACE guidelines, and we had a very specific section talking about, BMI is very good for screening. It's good for population studies, and it's good for screening patients and classifying them. But you still have to do an exam to confirm, is it even associated with excess adiposity or is it not?
Yeah.
Then, and it could be, swelling, it could be water weight. And by the way, on the other hand, we have patients who are thinner and frail with low muscle mass. So they have what we call sarcopenia. But they actually do have
obesity.
Yeah, they actually do have excess adiposity, but they might have a low BMI, so we can miss them if we don't do more personalized exams. And they have actually some of the highest risk of death and cardiovascular disease, especially when we start looking at abdominal measures, which are reflective of visceral obesity and putting people at risk of cardiometabolic disease. So that's why we refine the diagnosis of obesity using waist circumference or waist to height, which can help. It really just corresponds to that visceral obesity and is much more specific for an individual's cardiometabolic risk. And so, in this case, this lady, she is obviously one of the world's top athletes. I can pretty much tell from her picture she does not have abdominal obesity. I mean, she could get a measurement if she wanted to do more specific health examination of herself with her healthcare team in the future, just to make sure she's healthy forever. But that's just something people just need to know, that BMI definitely has its uses, but on an individual basis, it has to be much more nuanced.
Yeah, and you don't want to throw the baby out with the bathwater. She's
right.
You're supposed to assess for muscularity. She's clearly.
She's very
muscular. One
of the top athletes in the whole world.
Yeah. But, so anyway, that's all we'll say about that. The next thing is
we're gonna tread lightly.
The whole boxer issue, and this comes with issues of even nobody has, as far as I know, nobody even has all the facts. But the big thing going on right now is that people are making false statements about this, and then everybody's fighting what I would call straw man arguments, meaning you create something and start attacking that. So let's go over the background.
All right, so the background of this is the Algerian boxer Ayman Khalif's gender was questioned Thursday following a match that ended after 46 seconds when Italy's Angelo Carini took one punch and called it quits. And then everyone started, going to social media saying that, this person was a male fighting in a female division, right? And so part of this is because the International Boxing Association, the IBA, claimed that Khalif and another female boxer, Lin Yu Ting of Taiwan, failed what they called "quote unquote" gender eligibility tests at the 2023 World Championships. But the International Olympic Committee says that they're eligible to compete. The Italian coach is apparently the one who served up some of the suspicions and hearsay. But the problem is there's like no transparency around any of the actual facts from the IBA, who issued a statement that's saying that these two ladies did not undergo a testosterone examination, but failed a, quote, separate and recognized test whereby the specifics remain confidential, quote, during the IBA Women's World Boxing Championships in India in March 2023. So, there was a Taiwanese newspaper that said there was no other explanation other than a, quote, abnormality that was given for the disqualification of that championships. She's never failed any type of gender test. And just a little side note that I read about, I think this is legitimate. The IBA is actually in some sort of dispute with the International Olympic Committee over a deal that the IBA president made with Russia and a Russian energy company that was pressured to drop that to clean up ethical conflicts because of the invasion of Ukraine. There's all sorts of stuff going on. I mean, this is there's some stuff going on. And the IOC actually stripped the IBA sanction of Olympic boxing for this. Due to a lack of financial transparency and other corruption. So there is so much more to this that we don't know and don't understand. But the bottom line is that these two women have been competing in the sport for years, including the Olympics a few years ago. And it's not like they were like dominating the competition either. Khalif lost in the quarterfinals in Tokyo. Lin lost in the round of 16 of a different weight class. They've been tested without any issues coming up until this sudden 2023 test. And, people are talking about, well, this, the people who are trying to claim, oh, she's transgender.
Right.
It doesn't make any sense. That's the straw man. But that's what the media or some of these, I almost wonder if they're like Russian bots. I don't know. I don't want to dig into any of these crazy conspiracy theories, but Algeria would be a very strange place to, I read this, to incubate a star women's boxer who has actually been a man or began life as a man, because they have some very strict rules that you cannot be that in that country. And they even said their Olympic committee issued a statement strongly denying what it called, quote, baseless propaganda and unethical targeting and maligning of our esteemed athlete. And I will say that there is absolutely, we have looked through this. There is zero evidence that this is about transgender, masculine medicine or anything like that with these people. Now, do they have some sort of these very complex, much more nuanced than what people want to give credit to, genetic chromosomal abnormalities?
Nobody knows.
But nobody knows.
Nobody knows.
So now it's all hearsay. So people are saying, oh, but she's XY, which we'll do a whole episode.
There's no evidence of that, as far as I know.
So XX is the typical female chromosomal pattern, XY is male, but then there's all sorts of complicated things where people can be XY, the testosterone doesn't even either work, or it doesn't get secreted, or there are other
receptor
gonadal dysgenesis things where their body thinks it's female, so everything is female, but they might have those chromosomes. We don't know. That's what people are speculating, but people need to not speculate. Yeah, we don't know. Yeah, we don't know. We're just saying don't speculate because it's complicated.
What I think is interesting, we're in a very heated political environment right now. So I think people are using this topic to fuel rhetoric against
whatever.
Well, I don't know. I would say against the left. If we're,
it seems like
that's why I saw. That's what I was seeing on Twitter.
Or other countries are using it to fuel that fire because of that divide. And so they like to use fear and emotion.
Yeah.
So and now these star athletes are getting in the middle of it. And it's like all they're doing is just trying to be the best they can be. And by the way, they would knock out anybody who is talking trash. Pretty sure.
Probably knock me out.
Oh, guarantee to knock us out. Oh my
Knock
God. I'm not going to fight them.
I'll wrestle, but I'm not going to box.
I'll wrestle them, but yeah, if they get one shot on us.
Yeah, I'm going to have to shoot in or something.
Yeah.
But I think the point is, let's just try to get the facts, be scientific about it, as opposed to using emotion.
And be nice.
This isn't, please. But I think they're trying to make it a transgender issue, and it's kind
and it just is not.
It's not. That's not the issue. We're not even going to debate that here at all. It's that this is not supposed to be anything related to that. We don't know her medical diagnosis, and there's a lot of people speculating. We can
these different.
We can talk about some of those if we wanted to. I'd really like to do.
We'll get an expert in.
We want to get a geneticist in here to go over some of these. I was learning a lot about I've learned some of these things in medical school, but some of these some of these things are so rare that some of them were not even discussed. I don't think I even got anything on a medical board test about some of the things people were talking about. There's very classic ones that my brother was talking about, but
we get these, we do these in endocrine. And so I had to know a fair amount of this stuff for my endocrine boards. But I can tell you I haven't had a lot of referrals for any of this stuff. And some are not so rare, but then a lot of them are exceedingly rare. And I think a lot of the things, I think my pediatric endocrine colleagues might do a little bit more of this, maybe more of the geneticists.
Yeah. I remember, we had something called step 1, and this was these are very step 1 like questions for the basics, but some of these things are so rare that it wouldn't even have been on those board examinations. So,
we need to cool it, not talk without facts, not get, not let emotions drive, misinformation, disinformation, all that stuff. I mean, we do the best we can.
All right. That's it for the hot topics this week.
Hopefully this doesn't get me fired again.
No,
yet to be seen.
I've been fired multiple times. I'm kidding. True. I leave jobs. I leave jobs on my terms. Just my terms. All right. Here's our outro.
Godspeed.
This podcast is for entertainment and education and information purposes only. Remember, the physicians on this podcast are not your physician. It should not be considered professional or personalized medical advice. It should not be used to replace speaking with your physician or medical professional to discuss your specific health concerns. The topics discussed should not be used solely to diagnose or treat any condition. As a result, we are not responsible for any unwanted medical outcomes. The views and opinions discussed are of those of the host only and do not represent those of any other entities.